everyone, welcome to my channel to share your story. In this video, we'll have Dr. Chen to share his experience about medical training and sports training too.
My name is Dan Chen. I'm a pediatric physician as well as a sports medicine physician. So just wanted to share a little bit about my path and journey there and what that looks like for anyone that's interested in medicine or sports medicine. Tell a little bit about how I got here.
Yeah, that's very interesting too.
Yeah. So I guess to start with, in the United States, so some countries, medical school, you go to medical school right after high school. But here in the U.S., everybody has to go to undergraduate first. So after high school, I went to University of Florida, and I got my undergraduate degree in applied physiology and kinesiology, which is essentially it's a study of how the body works, and with a special focus on how it moves and how it performs during movement in sports. So I've always had an interest in sports. Growing up, I liked to play a lot of sports, playing outside and playing football, basketball, soccer with my friends, that kind of thing. So
You play so many different kinds.
yeah, pretty much anything that involves competition or sports I enjoyed. So so then when I went to college, I was looking for a major that would fit my interest in science as well as a little bit of the sports background, exercise, that kind of thing. So I found that applied physiology, kinesiology was a really good major for me. I had a little bit in my mind that I wanted to pursue medicine. I think because of my experience with my dad, who you know. So he's retired now, but he was a gastroenterologist, so stomach digestive specialist. And so growing up, I was able to see, how much he enjoyed his work and what he was able to do for his patients and even for people at our church. We had friends, if their kids were sick, they would ask him for help. Even though he wasn't, a kid doctor necessarily, but he was a doctor, and so he could help them answer some questions. Yeah, so I always thought that was cool that he could help people in that way. And so kind of had that in my mind going into college. So, and he always told me, this is a good job. He never, I wouldn't say he pushed me to do it or anything, but he liked his job, and so he would tell me, I think this is a good job, and you get to use your mind a lot, and you can help people. And so I said, yeah, let's, that seems cool, so I'll try it, I guess. So I took a lot of the undergraduate courses. So there's certain requirements for medical school that essentially every student needs to take. So it's probably different now. It's probably changed since I've been in school. But there's things like biology, chemistry, organic chemistry, physics. There's a list that you can find. So I made sure to take all those courses in addition to my major courses. And then generally how it works is in about your third year of school, you have to start looking at applying to schools. So I started applying to schools. I took the MCAT, which is kind of like the entrance exam for medical school. So I did that, and then eventually I got accepted to the school I went to, which is Bachelor College of Medicine in Houston. So have you been to Houston before?
No.
Yeah. It's a good place. Yeah, it's a big city. It's I think it's the 5th largest city in the U.S. A lot of people. They have a really large medical center there. A lot of different hospitals. So yeah, I ended up going there. I felt very blessed to be able to have gone there for school. One of the things that was nice is that actually a lot of the Texas schools are cheaper for tuition, which is good because medical school can be very, very expensive. But because it was from Texas and because it just happens to be one of the cheaper schools, it worked out that I was able to go there. So that was good. So in medical school, how things generally work is traditionally medical school in the U.S. is 4 years. So the first 2 years are mostly in the classroom. So you're learning very intensive, focused courses on anatomy of all the different organ systems. So, you know, we do a couple months on the heart, a couple months on the kidneys, a couple months on the nervous system. You do your anatomy lab, where you're doing, you know, dissections of cadavers, that kind of thing. So usually that's very focused in the first 2 years. And then the second 2 years, you spend more so in the hospital. So you're working with senior physicians under their supervision and trying to learn, you know, what it looks like day to day to be in the hospital. We call it like rotations. So your clinical rotations, traditionally they begin in the 3rd and 4th year. Yeah.
So, or after you finish 4 years, actually have a lot of experience already, huh?
I guess yes and no. Yeah, you.
Depends on where you go, you mean?
Yeah. Well, I think medicine is one of the things that the more you learn, the more you realize what you don't know. So, you know, so for rotations, everybody has a set of, for example, core rotations. So there's things like family medicine, which is they care for everyone in the family, right? So from babies up to elderly people. Then you have something like pediatrics, which is what I did, which is more focused on kids. Then you have things like surgery, which is, you know, very different. You're doing, obviously they're doing different types of surgeries, like, you know, taking out the appendix, taking out the gallbladder, that type of thing. Or something like OBGYN, which is, right, so that's caring for pregnant women and going through like the labor delivery process. So there's certain core rotations that every medical student in the United States has to do in order to graduate.
Oh, so everybody have to know that, and then before you choose one specialize.
Right, yeah, so that's the goal. So yeah, you have to, essentially, it forces you to two things. So yeah, kind of see all the different specialties before you choose which one you want to pursue further. And also, it helps you at least have a general understanding of all the different specialties and have a good core understanding at least of what they do. So after 4 years in medical school, in some ways you do have a lot of experience. You've experienced all the different rotations. But at the same time, I would say you still don't really know that much because, you know, you've only, so for example, if you choose to do pediatrics like I did, so you probably have done 2 months of a pediatric rotation, plus maybe a few other special electives. So even at that point, you're still only doing maybe 4 or 5 months. So there's still a lot for you to learn even after medical school. It's a good way to get a lot of exposure to different fields, because most people that, when you start medicine, I think most people don't, some people have a very strong idea, like, you know, I want to do this, I want to be a surgeon, I want to be anesthesia, or, you know, whatever. But a lot of people don't really have an idea, or they have some kind of idea, but when they start to get into school, they change their mind. So I think it's important, you know, I would say to have a little bit of an open mind when you start school, and try to get an experience for what the different fields look like before you choose what you want to, you know, ultimately pursue. Which the next step is called residency. So, you know, after medical school, you're not done. You have to do what's called a residency. So a residency is essentially, it's another few years of specialized training. But at this point, you're officially graduated. So after medical school, you are a doctor. You get your MD or your DO. But then you can't really be board certified. You can't practice without completing a residency program. So the length of the residency program is different depending on what type of specialty you choose.
So that's a lot more years again.
Right. So yeah, so the minimum is 3 years. So the shortest one is at least 3 years. The longest one I think is maybe even up to like seven or more years.
Wow, that's
so depending on what you do. So you know, so there's kind of, I guess the other differentiation to talk about is a lot of times people, when you start medical school, they'll say like, do you prefer the pen, you know, writing, or the knife, right, cutting, right? Like like surgery? So do you prefer more a specialty where you're thinking, you're talking to people, you're writing? Nowadays it's more computers, but in the past they said pen or the knife, right? So do you want to do surgery? Do you want to do procedures where you're cutting people, that kind of thing? So that's kind of one big differentiation, because there's definitely fields, a lot of fields you do a little bit of both, and obviously surgeons have to talk to people too, and they do a lot of work in the office, but you know, that's kind of one of the big differentiators. So the surgical subspecialties tend to take longer, you know, for residency, because they just have more things that they need to, you know, you need more hours of training to do certain types of procedures, certain surgeries. So things like general surgery or ophthalmology, where they do surgery in the eye, or orthopedic surgery on bones. Those things tend to be 5 years or sometimes more. So I think sometimes like neurosurgery, that kind of thing, can be even longer. So,
wow, it's really long way turn to be a doctor, real doctor, huh?
Yeah. It's a long path. But yeah, I would say, you know, so the good thing about residency is that once you start residency, it is a job. So, you know, you're not in school anymore, so you do make a salary. I mean, it's you know, it's not, it's maybe not as much as like some other jobs, but it's not bad. So you do make a salary, and, but it is a lot of hard work. It's you know, some residency programs you work from anywhere from 70 to 80 hours a week. A lot of times in the hospital, a lot of long overnights.
That's a lot of time too.
Yeah.
70 hours a week. It's almost double than the regular job. You know?
Right, yeah. So it's a lot of hours.
So you should get plus so many years in the school just working so many hours.
Yeah.
That's a really tough job, actually.
Yeah. So, but yeah, you know, so for me, I guess, so for what my training looked like, so I was doing pediatrics, so I had a lot of rotations that were, again, you kind of do the same thing, you're doing rotations, so a lot of different rotations in the hospital. So I would go through with different specialists, so either, you know, sometimes like pediatric cancer unit or pediatric GI, like people with stomach issues, or pediatric neurology, so kids with like seizure disorders, epilepsy, that type of thing. So again, you start doing that, you rotate through all different fields, but this time you're focused on kids, on your pediatric focused, compared to med school where you're doing everything. So it was that time when, you know, again, we talked about, I always liked sports, I always liked exercise, so then I had done some rotations actually in medical school with someone who was a pediatric sports medicine doctor. And essentially that was when I realized I really liked that. And so, and what that is it's different than orthopedic surgery. So I don't do surgery, but I do treat a lot of different athletes or young people that are active for any type of injury that they might have related to sports, or even just things like falling off their bike, falling off the monkey bars, that type of thing. So yeah, if someone has you know, they hurt their wrist or hurt their knee, or they hit their head, they think they might have a concussion. Those would all be things that I would see. And so...
It's all kind of sports medicine.
Yeah, right. Yeah, and so when they come in, you can sort of decide what they need as far as, you know, do they need x-rays? Do they need MRI, like different testing? Ultrasound is becoming more and more used, which is a tool that looks at, similar to when they ultrasound people for babies.
Yeah,
they use that. They're starting to use that more and more for musculoskeletal medicine, for sports medicine. So then you can just decide the treatment plan. So, you know, if I think someone needs to be in a cast or a brace, or if they need to do physical therapy, or sometimes they do need surgery, so then I refer them to one of my colleagues who does surgery to see if that might be. I decided I wanted to do that, which actually is another year of training. So after residency, you have what's the option. You don't have to do it, but you have the option of doing what's called a fellowship.
Fellowship.
Yeah. So essentially, that's more additional training in whatever specific field you want to pursue. So, for example, so I did mine in sports medicine, but you can also do it in, say, I had friends that did cardiology or GI, like my dad did, or that kind of thing. And so, again, depending on what you do, mine was the shortest, so it's just 1 year. But if you do cardiology or GI, things like that, it can be another 3 years after residency.
Wow.
So if you add it up, it's a lot of grades.
Yeah.
I tell kids sometimes that I see that I think I did 24 grades, but other people did more. So it's not even. Mine was probably almost even on the shorter side for medicine. There's definitely people that do more. Fellowships are they're hosted at different institutions. So it's kind of a similar process. You have to apply. You have to send in like applications. They'll look at them, get the interview, that kind of thing.
So like after this, you'll get paid, or still you have to pay?
No, you do get paid. Yeah. So similar to residency. So basically, once after medical school, during residency and fellowship, you do get paid. So
Like you give some advice to the high school students who are interested in medical school.
Yeah. I would say a couple things. I would definitely recommend for them to try to get some exposure. So, and really, maybe follow a doctor, shadow a doctor, or talk to somebody who is a doctor, and just get some ideas of what it's really like. Because as we talked about, it is a lot of school. It takes a really long time, and in medicine, there's so many different fields that you can go into. So not just in medicine, but there's also things like that we haven't talked about today, like physical therapy, occupational therapy, nursing. I mean, there's many different things even within the medical field that you can do. So I would say it's good to talk to people and really get a sense of, is this something that you think you're really interested in? Because it's a big commitment, it's a lot of hours. But I would say, if you're somebody that likes to be challenged and think a lot constantly and really always have to be adapting and changing at your work, then medicine might be a good field for you. Because it's not going to be something where after a couple years you're just good at it. Because things are always changing, and you always have to kind of learn and adapt to keep up.
After you start practicing doctor, so what you do for update?
Staying up to date is very important. Because things are always changing, or there's new research that comes out, new medicines, things like that. So it can be hard, I will say. I mean, there's different ways. I mean, there are requirements in terms of it's called like continuing medical education. So every board, every state board, and also every licensing board has different requirements for the certain number of hours that you have to do every year to essentially for continuing education. So people will put out, you can get those in different ways. There will be a lot of times they're through conferences. So they'll put on like a big educational conference, 2 or 3 days. They'll have a lot of different speakers, and so you can get a lot of hours that way. Sometimes they have these same things online. There are other things you can do. They have some of these board certifying agencies have online quizzes where they'll send you questions, essentially kind of like board questions, and every year you have to do a certain number of questions. So those are all ways that you can get those hours for continuing medical education, and that can help you kind of stay up to date. Probably the other couple ways that you can do it is also through there are a lot of research journals. So there's a couple big journals probably for each field. So for pediatrics, I mean there's the Pediatrics Journal, which is from the American Academy of Pediatrics, and so every once in a while they'll put out new different papers on, hey, this is what's new for ADHD, or this is what's new for ear infections, or they just recently put out actually a new one for treating babies with jaundice. They just updated that one. So usually when that happens, you can. A lot of times doctors you're on these email listservs, so you get an email like, hey, there's like some new papers coming out, or a lot of times honestly it's from your friends or your colleagues. They'll say, hey, have you heard about this? And then that's how you can go and read up on things and see what's the latest research is.
So that's good way, huh?
Yeah, and it's important because like I said, medicine's always like an evolving field. There's new technologies and new things being discovered, so you don't want to. You want to do what's best for your patient, and so that's the exciting thing too. You don't want to do things that are outdated.
Yeah.
But that's the exciting thing too is like maybe today you see somebody you can't really do too much for them, but maybe in 20 years you'll have better medicines or better treatments for that person. So.
Like after 20 years, we don't think about that anymore. We always keep the same looking.
Oh.
Just like still 50, even 80 years old, still just looking like 40,
Yeah.
30.
Yeah, we'll see. I don't know. Yeah, maybe.
That's
Yeah.
a big hope.
Maybe one day. Yeah, we'll see.
Thank you for sharing your experience.
Absolutely. Thanks for having me.
Thank you for watching.
If you would like to share your story, visit our website at shareyourstory.chat.